pleased and grateful that of course we're here at this press conference called by the Public Service Union to address two critical issues in particular, one relating to COVID-19 pandemic, and to be more specific, the issue of mental health, and the other issue having to do with the 1% increase on the customs service charge that had been announced by the Minister of Finance in the recent concluded budget. The Public Service Union, since the pandemic touched St. Vincent in March of last year, have been doing their part in trying to ensure that staff, workers are kept safe, and also that management within the different corporations or within the public service are doing what is necessary to keep staff and other workers safe. We have written a number of letters to departments regarding COVID-related issues. We have written to all of the corporations whose workers we also represent. And when you talk about departments, the one that we're going to talk about this morning in specific is mental health. We have addressed that on numerous occasions. We have also had what we call made a public intervention in having to do with speaking to the public. We would have done a motorcade with respect to the protocols and trying to encourage the public and workers to follow the protocols. So as a union, we have demonstrated how responsible we were in trying to assess the government and the people of St. Vincent with the management of COVID-19. Mental health situation presents itself, and it is one in which we think could have been better handled or avoided. At this particular time, I'm going to ask our public relations officer, Shellen Alexander Ross, to speak specifically on the mental health issue and the intervention that the union made since going back to last year when we were impacted by the pandemic.
Thank you, Brother Boucher. As you would have mentioned, I'm Shellen Alexander Ross. I am the Public Relations Officer for the St. Vincent and the Grenadines Public Service Union. And to my right, we have our Industrial Relations Officer, Brother Joel Poyer, who is with us today. So, as was mentioned before, we will be dealing with the issue in relation to COVID-19. As we know, it has been a challenge and it has affected us in one way or the other. So, we as a union, as you know, we represent our members. Once we are informed that there are issues that are happening in a particular institution, we have an obligation to investigate and to address it accordingly. So in March of 2020, the 25th of March 2020, the union wrote to the Ministry of Health, the Permanent Secretary, and the union had asked them to address a number of issues, a number of concerns that would have been plaguing the staff at the Mental Health and Rehabilitation Center. And at that time, we noted that our correspondence were not acknowledged. We didn't receive any info with regards to any meetings or anything like that. At that time, it was also noted, or it was brought to the attention of the union, that the management there were focusing on self-preservation without giving consideration to the well-being of their subordinates, which is the junior employees, where they were not equipped with the pertinent kits to protect themselves from the exposure of the coronavirus. And that letter was in March of 2020. In April of 2020, the 27th of April, we wrote again to the Permanent Secretary that we were deeply troubled because the issues that presented themselves were still not addressed. And that is from 2020 April. The union received another correspondence from our union, our section rep, Mr. Alpha Williams, Mental Health Center. And a number of issues were highlighted. This was the 25th of May 2020. A number of issues were highlighted. And the correspondent made reference to a meeting that was held in April of 15th of April. Present at that meeting was Permanent Secretary, they had management from the Mental Health Center and union representative, and of course our section rep, Mr. Williams. These are some of the issues that were highlighted. And remember, we're focusing in relation to the COVID pandemic and how it would have affected the workers at that facility. Masks continue to be a problem. Some members were asked to buy their own masks. They were provided with dust masks, that is the information we received. Dust masks were provided on the wards and nurses were asked to hand them over at each shift. There was an issue in relation to admission. Admission continued to be a concern, and of which they were expected to have the necessary equipment to do the admission. There was an agreement coming out of that meeting, as far as we were told, in terms of the admissions would have been isolated or quarantined, for that matter, for 14 days before they would have been allowed to go into the general population there. Another issue that was raised, or that came to our attention, is that no proper sanitization system was in place that would have facilitated regular hand washing both for patients and workers. And the union at that time was concerned that in the event that there is one episode of COVID-19, there would be a breakout, and that would have been disastrous for both patients and workers there. In May of 2020, 28th of May, another letter was sent, unresolved issues at the Mental Health Rehabilitation Center. Again, wrote to the PS, and this was basically a reminder of the meeting that was held and all that was discussed, that the ministry vowed to work along with the persons there in addressing a number of issues that was raised by the Public Service Union. In addition, we noted that, again, there was inadequate supply of masks that was provided. The issue of sanitization, no proper sanitization area for both patients and workers. The admission process was still continuing, and at that time it was mentioned again that persons were not given the 14-day quarantine as was expected, as was agreed upon before they would have been allowed to mix with the general public, the general population there. So the union once again was appealing for concerted effort to help to alleviate the stressful conditions under which the employees at the Mental Health and Rehabilitation Center were working. After such, the issues continue to come to the union. We continue to be reliably informed that the issues that were discussed were still plaguing the workers, still not being addressed. We wrote again on the 15th of July 2020 to the public, to the permanent secretary, outlining again the number of issues that were raised by the staff at mental health. And masks continue to be the issue. Again, that they were not, at this time they were given some, but the manner of which they received them, we were informed that the masks were provided in a bag for workers, and the unused mask was to be handed over to the other shift. They were concerned that the masks were actually removed from the original container and placed in this bag, so they were looking at it from the angle of being cross-contamination, where I would not be allowed to actually take my mask from that package. The hand washing facility was installed at that time at the front of the facility, but there was none on the inside, again, for the patients. And 2 rooms at that time were being designated for quarantine and or isolation purpose, and the 14 days quarantine period was still not adhered to. So you had persons or patients rather coming in because of the fast turnover. The spacing wasn't there, so persons weren't allowed to do the 14 days and therefore were placed back into the general population before the 14-day period. So the union did express that they appreciate the fact that the ministry had or was trying to do some sort of investigation about the issues that were highlighted, and we were basically trying to see if the ministry would address the other issues as was outlined in the correspondence. So let's fast forward to March 2021. Again, we received, as we are all aware of the outbreak that has happened at the mental facility, just over a week now. So we received a correspondence from our section rep, Brother Alpha Williams, and these are some of the issues that were highlighted. A single kit containing personal protective gear was only given to the nurse, who was the one doing the admission, and the other persons on that shift were practically exposed, as far as we were told that they were not given anything to protect themselves from this highly contagious disease. When staff, according to Mr. Williams, when staff requested masks from central stores, they were advised that there were no reported case and the staff does not need to be provided with masks. We were also informed that patients are still being admitted to the center even though there has been an outbreak in the corona virus. Patients are still being admitted to the ward without doing the 14 days quarantine period. And there was still no proper or suitable area for isolating or quarantining newly admitted patients. Several staff, according to Mr. Williams, were advised to purchase masks because the Ministry of Health, as far as they were told, was not supposed to purchase these masks or babysit the persons, according to what we received, the reports. And there was a concern that there was no shield around the nurses' desk or the staff area where the nurses work. The Ministry of Health has the patients who were diagnosed with COVID-19 has been transferred to a facility. We were told at Queen's Drive, where they're being nursed there. And reports that we received that there are only one staff nurse present there, one staff nurse, one nursing assistant, and 2 nursing aides who would work, the staff nurses would work 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. is the 12-hour shift. The last time I counted, or the last record that I got, is 100 cases, reported positive COVID cases. So that is the ratio that the one nurse and the one nursing assistant has to deal with. Now, so you can see we have been speaking with having dialogue with the authorities at mental health and the PS in effort to try to address the number of issues that the nurses, nursing aid and health workers in general were facing at the facility. We all know that COVID-19 is a highly contagious disease. We all know that it is spread through the droplets from infected persons who would cough, sneeze, or even talk. And healthcare workers are frontline workers, so they are the vulnerable group in terms of higher chance of them being affected once exposed to somebody who has COVID-19. So the issues that were raised here, according to our members, or according to the persons that came forward and reported them, are unacceptable, because we would have already set the base that COVID-19 is contagious. We are frontline workers and we have an obligation to be protected. So you may ask, well, what do they need? For months we have been telling the general public what to do in terms of how to protect ourselves. We have been talking about hand hygiene, we have been talking about wearing our masks, we have been talking about keeping a physical distance. Now if workers have been told, okay, you don't need to be provided with a mask, or we would not provide you with a mask, how the facility, as far as we were told, is set up at the mental health facility, there is no room for physical distance where the patients are concerned. And if we would have asked for washing stations or hand hygiene stations to be set up so that persons, whether patients and staff, can have regular hand washing, and that wasn't done. To me, you put in the persons at risk. So the workers should have their masks. They should be given an area that they can wash their hands, or the 70% alcohol-based solution, and protective gown over their clothing or their uniform. So if you're telling me that you have an admission process happening, you have a nurse that has to be there, you have the nursing aides that have to be there, and the nursing assistant, and if from what we were told, one person is being provided with the necessary PPE, what is happening to the other three that are standing or sitting there? Because we also have to be mindful that COVID-19 positive persons don't always show symptoms. And because of the highly contagious nature of the disease, we just cannot take any chances. So we have been trying to address the issue for a while, and we basically have an attempt to try to rectify the problem at times when the union would have made the appeal, and then the workers would say, okay, well, after that we're going back to the same place where we were. I want to address the issue in terms of the workers being told that they must buy their own masks, or the ministry is not obligated to provide masks. I want to read briefly from a document from one of our credible organizations, the World Health Organization. I want to read some section from this document, which is entitled Coronavirus Disease Outbreak, Rights, Roles and Responsibilities of Healthcare Workers, including key consideration for occupational safety and health. And this is what it says in relation to the employers and the managers of the health facilities. So health workers' rights include that employers and managers in health facilities, 1, must assume overall responsibility to ensure that all necessary preventative and protective measures are taken to minimize occupational safety and health risks. Provide information, instruction and training on occupational health and safety, including refreshers training on infectious prevention and control, and the use, putting on, taking off, and disposal of personal protective equipment. 3, provide adequate PPE supplies, which includes masks, gloves, goggles, gowns, hand sanitizer, soap and water, cleaning supplies in sufficient quantity to healthcare or other staff for suspected or confirmed COVID patients, such that workers do not incur expenses for occupational safety and health requirements. The workers are at work, they work in an area, the fact that you are a frontline worker, occupation and health safety comes into that arena. And we're hearing from the WHO what is required from the employers, the managers, to put things in place to protect the workers. Now the Ministry of Health has a slogan that says, health is a shared responsibility. And I am in agreement. Because we as healthcare workers have an obligation to provide the care to the patient based on our level of training. The patients or our clients have a responsibility for their health to make sure they eat right, take their meds, sleep right, and so forth. The ministry also has an obligation to make sure that facilities or things are in place so that workers can execute their duties according to their job description or execute their duties in a safe manner to protect them and their families. So, the union stand on this matter is that what has been happening to our workers at mental health is unfortunate and is basically unacceptable. Because I've given you the track record, or I've taken you back to last year, March, when the issues were coming to us that at that time COVID was now on our shores, and we were trying to see what we can put in place so that we won't end up at the stage where we were. That it would have been better managed, it would have been prevented, and things would have been put in place. Because in one of the correspondence, the union also mentioned that if there is only one case, what are the chances, what can happen? And we have seen the evidence now of the number of cases that are present now at the mental health center. So we are hoping really that the ministry is going to try their utmost best to see how the issues can be addressed. The union is going to stand with the workers from their end to continue the fight in terms of getting things in place for our workers. Now, we have been unfortunate enough to have 8 deaths. in relation to COVID, and we have had quite a number of active cases, a number of which has recovered. There has not been any drug, as far as I know, that has been developed to actually cured or 100% prevent COVID altogether. It brings me to a question of vaccination, or the issue of vaccination. And many have asked us as a union, what is our stand where that is concerned? We know that from decades that vaccination has provided public health benefits in terms of preventing a lot of the communicable diseases like the mumps and the polio and so forth. So we have evidence of that. And we have not had any sort of normalcy, but the world generally, us in St. Vincent, Caribbean and the world, in terms of how the life that we knew. We have to wear our masks, we have to keep our distance, we can't have activities. And that has been happening since last year. It's over a year now. Now there are a number of organizations that the WHO, the CDC, PAHO, that has recommended, they have made recommendations that in order for us, or in order for the world at large to get back to this level of normalcy, there need to be a significant level of community immunization or immunity. How do we get to that place? So what was from research and what was discussed is that vaccination can be the method in terms of taking us from where we are to a level of normalcy. So it's based on that and based on what is happening. We want to encourage persons to make an informed decision to be vaccinated. Okay, so we hope that persons basically would think about it, think about the situation that we're in now, and think about how we are going to get to the place where we can all be together, that we don't have to be wearing this mask all the time and so forth. So that is, those are the issues that we wish to mention at this time in relation to what is happening at the mental health center, what the workers are experiencing, and as to the way forward now with the union in getting these matters addressed urgently. Not tomorrow, not next week. See how we can deal with the issues today. Okay, thank you. I don't know if Mr.
Brother Poy is our industrial relations officer, and he has been addressing some of the issues at the mental health. Like he's been the one interfacing with reports when they come in. So I'm going to ask him to say something regarding this matter.
Well, good morning to the press. What I can say, since the first week in February when I started working here, first report came in from mental health concerning the situation out there with sanitization. There was no room to quarantine patients when they comes in, and the whole situation concerning masks, where person who were in charge refused to offer masks to the number of workers, and they were told that is their responsibility. And as you can see from the WHO report, that is not such. So they had to tell them. So I quickly sent a document to the executive to write to the permanent secretary, because there were also calls from other areas with similar situation, because they were called from Union Island and Trinidad Coast Hill about the same thing about not getting masks for the other workers there. So we wrote to the Ministry of Health, tell them to look in and address this situation as urgent as possible. For an update on last week Thursday about the situation at mental health. And lo and behold, by Saturday, situation is that there were reports of about 20% testing positive, and then by yesterday it reached 100. Now these people at the mental health are one of the most vulnerable people in our society, and we are of the opinion that these people should have been looked at after in a special way, because they are not in their full capacity. So why should they be treated in the manner that how they are being treated? Because we have reports whereby where they are at Queen Drive, the space is not adequate enough. We have 2 persons under there, which is, can see people have COVID, and you having 2 persons under there, you have persons on the ground. You have the workers working at 12-hour shift, and there's only 4 of them, which is woefully inadequate for such a situation. So it shows that the management does not realize the situation that we are facing. And some of these people are diabetic and hypertensive. So they are vulnerable with a mental capacity, and then they have other chronic diseases that are affecting them that COVID could deal with. But instead of it being addressed today, they are just putting up a plaster over a sore and not trying to clean the sore in any proper way. And these are the situations that you see, and then they are not being truthful and trying to have dialogue on how to address this situation. We from the union here want to walk along because we realize the impact that it is having on the nation. This is a country thing. But they have people in management who do not know their responsibility and their role that they should be playing. And I don't know if they really understand the situation that we are facing, because of a population of 270 patients and about 60 staff members, and you have 100. It is almost a third of the population of that institution, in both workers and patients. What are in place now? We're going to be doing contact tracing as to how it got in, where it came from, and who are the persons that you have to take. Is it all of the workers now have to do contact tracing at their home and all that? Because there's about 8 workers who also have been affected. And these are serious things that could make it even get worse. Right now I see as a catastrophe that is taking place at the mental health, and the way how it is being treated, it is treated as if it's a simple matter, and it needs to be addressed urgently. That's all I have to say on that situation as well.
All right, so we have had the information regarding the mental health issue. But just to add, before we move on to the other issue that we're going to be addressing, this issue at mental health falls squarely at the feet of the management. And I want to make that quite clear. The inept, poor management of the institution. An institution that is managed primarily by Sister Medford and Sister Gildes. And it is not the first time the union has been alluding to this problem with management, their attitude towards workers and patients, the lack of concern and empathy. In one of our letters that we would have penned to the ministry, May 20th last year, the union said the way the mental health rehabilitation center is being managed mirrors that of a despotic regime. So that's what I'm to tell you this, how strong those words are. And that is because of what we have been experiencing with this management. Moreover, the insensitive nature of the management team suggests that these persons should not be allowed to carry out any human resource related activities. And that is very serious. Their attitude has resulted in this problem at the mental health institution. If you had different managers, and that's our view, the impact might have been lessened. The workers would have been protected. When workers even report these issues, the management go after the workers. At one time, their 2 days off was taken away simply because they were reporting the issue. You have to go to the ministry to get that to be reversed. As long as the management of the institution remain this way, as long as those persons are in charge of mental health, you're going to have problems. And the Ministry of Health, the Public Service Commission, the government need to take note of that. It is not in the best interest of the management of the institution. The overcrowding situation was being addressed for a long period of time. And maybe this is an opportunity for the government to really take some serious steps and look at this issue. There is serious need for reform at the mental health institution. Those patients are human beings. They are brothers, sisters, parents, relatives. They are people. They have human rights. And the way they are crowded in that institution, like cattle, that cannot be the proper way of treating people. In my view, that's a violation of their very own human rights. That is why what we feared, an outbreak among one, will spread rapidly. I think the numbers now are 100. It's over 100, because I just got a report that there were 2 more staff and 7 more patients that have been infected. But part of the solution, in addition to the interventions medically, part of the solution has to be something must be done with respect to the management. They have had management in the past. Sister Bailey, the persons who managed the institution before, you've never had so much resistance and so much animosity from them in trying to address the issues. You've never had that. This is the very first time that we have experienced this sort of thing with any management. Remember, Nicole Bailey was a former head of that institution. Sister Hathaway, Sister Grace Walters. All of those persons had a different approach. But this current management takes the cake. And the ministry needs to do, and the government, Public Service Commission, need to address that situation. And so we await and we look at what is unfolding there and how it is being managed. The other issue that we have been addressing has to do with the increase in the 1% that was announced in the 2021 budget. It's an increase in the custom service charge from 5% to 6%. And that was announced according to the Minister of Finance. The funds, he said that the funds will be ring-fenced and go directly towards the country's contribution to regional institutions, including the Public Health Agency, CARFA, the PAHO, Pan American Health Organization, Eastern Caribbean Civil Aviation Authority, ECCA, UE Seismic Research Center. And these institutions, of course, are important. In December 9th, 2020 article, entitled COVID-19 is driving up food prices all over the world, the International Labour Organization, ILO, reported that the food component of the Consumer Price Index, CPI, has increased at a much faster rate than the overall CPI in the regions of the world. And the article stated that globally, the price of food products in August 2020 was on average 5% higher than in August 2019. The article further went on to state that increases in food prices can have a major impact on living standards, and I want to stress that on living standards, on lower income households, of which such households will find themselves in difficult situation. We must bear in mind that in St. Vincent, a large percentage of our food supply is imported. In fact, the International Trade Center has cited the 15-member CARICOM grouping as importing 90% of its food from the US. Based on this information, one can easily perceive how the application of a 1% increase in custom service charge will further exacerbate the price of imported goods in St. Vincent and the Grenadines. We also had an increase in the price of oil, and we know the impact that can have. In February of this year, and that is February 19, in the Southside newspaper, there was an article there from businessman Leonard Anderson, the proprietor of General Hardware Supplies. And he stated that there has been a tremendous increase in prices of many goods on the world market, including lumber, steel, plywood, light hardware. The price of steel has risen by more than 50% on the world market. Costs of manufacturing and shipping have increased dramatically since the pandemic. Shipping costs in some instances have increased by over 300%. This was also echoed by Mr. Lance Oliver, proprietor of Rent and Drive. And he intimated that there has been an increase in motor oil prices since the pandemic. So Vincentian consumers, population, the poor, the not so poor, are facing a double whammy. An increase in the price of goods from countries where they are sourced and an increase in custom service charge. While the reason put forward by the government for the 1% increase may be well-meaning, and I believe it is well-meaning, it must be noted that the implementation of the sale will ultimately translate into a further increase in the price of imported consumer goods. Undoubtedly, government will generate more revenue from the increase in custom service charge. Furthermore, the value-added tax, the VAT, will also increase in the short and medium term because the compounded price and the value of goods purchased by consumers at retail outlets will be higher. And that is quite logical. If the ordinary man was spending $100 at the supermarket at the end of the month or whenever, that increase If it goes up to $150, you'll be paying VAT on $150 versus paying VAT on $100. That is, you'll be paying an increased VAT in addition to the increased cost of the food itself. So the Vincentian public, and I said the poor and others, will be paying twice given this 1% increase. While it may sound like a small increase, the impact will not be small. And we are of the view that given the extenuating circumstances, it may be imperative for the government to refrain from increasing the custom service charge until the world is out of its pandemic mode and when the global economy begins to show an upturn performance. In addition, it will be more prudent to do so when prices for commodities of raw materials on the world market begin to show signs of stability. So we think it's important for the government to wait a while until what is happening across the globe, particularly in St. Vincent, have subsided somewhat. The poverty rate, as we are aware, is around 36%. And with this increase, even without the 1% increase, we expect that that will go up. But it will be made worse by the 1% increase. And so, for a government who often speak about the poor and who have a robust social program, they should realize the impact of this service charge will be very serious on the poor and on the marginalized. I want to suggest to the Minister of Finance that these monies that they are seeking in the short term and medium term can be gotten from the unpaid taxes that are owed to the government. In 2018, we were told that is $169 million in unpaid taxes owed. Government granted a moratorium of 3 months. During that 3 months, according to Eyewitness News, only $8 million was collected. Government stated that they were beefing up the legal resources at the Inland Revenue Department to ensure that these taxes are collected. In 2019 budget, we hear again the Minister of Finance, who stated that the Inland Revenue Department has completed its preparation to pursue delinquent taxpayers using all available administrative and legal means. This work will continue aggressively in 2019. After reducing taxes and offering amnesty, we must now act against those who flout the tax laws. Taxes should be lower, simpler, and fairer, but taxes must be paid. We expect more aggressive collection techniques to bear fruit. And in 2020, the minister again stated, for too long, administrative inertia, intransigence, and a stubborn resistance to a culture of more aggressive tax collection have stymied the effectiveness of the Inland Revenue Department. The result has been uneven and unfair burdens being placed on compliant taxpayers. Uneven and unfair burdens on the ordinary taxpayer. In fact, all public servants firstly have to pay their taxes. They don't even have a choice. And I'm glad that the minister cited in 2020 that it was unfair for taxpayers to be paying their taxes, those who are compliant, while there's $169 million or so outstanding from persons who deliberately, in many cases, are not paying their taxes. And he said, in 2020, armed with legislative changes, human resource improvements, and physical enhancement to the work environment, the Inland Revenue Department has resolved to address certain geographical and occupational block holes in revenue collection. Some locations and some professions Some professions simply do not pay their fair share of taxes. Others disproportionately withhold VAT and PAYE monies owed to the government. Why should the public, why should the poor, why should the not so poor, why should the challenged public servant, the middle class person, where this middle class is actually dwindling, why should they pay the price for the Inland Revenue Department, by extension government, not doing its job to recover over $100 million in taxes? Don't you think that is what, that will be more than enough to pay these organizations? From the 1% charge, the government says it will collect some over $9 million. 100 and something million dollars is double time, triple time, quadruple time, more than $9 million. We are urging the government to defer this increase. Instead, seek to recover, as has been stated, aggressively the outstanding taxes owed to the government by defaulters. It is highly unfair to bring further burden to the public, to the poor, during a pandemic, when there are persons, rich persons, those who have it and deliberately refuse to pay the VAT, the PAYE or corporate taxes. Why should the ordinary man have to pay the price for all of that? Government has been set up to protect its citizens. This is a time that we need protection, financial protection. And we know that the government is burdened financially. But there's a source for whatever is required. And if the Inland Revenue Department is creating the problem, if they are the stumbling block, then the Government Service Commission has the authority to do what has to be done to get the right people there to collect these monies. Government came to us in the budget and they stated what was owed. So they also need to tell the public how much of that has finally been paid since the $8 million was actually paid, and how much is outstanding. And the Public Service Union do not believe that the public workers, the poor and not so poor, the downtrodden, should bear the responsibilities of a non-paying, of those non-paying taxpayers, lawyers and other professionals who owe millions of dollars should pay up so that no one else has to carry their burden. And we hope that this increase in customs service charge could be deferred. So we'll open up this time for questions. So I suppose we were very concise and to the point, in addressing the issues.
Good morning. My name is Asher Peters. I represent the news newspaper and Caribbean Independent Broadcasting Service. And first of all, I think I heard it was said that nurses were instructed to use dust masks to change them, to share dust masks.
That's what was reported.
Is that correct?
That's what was reported to us, yes.
If that is so, then isn't there a danger in transferring the virus?
There is. Because we remember, as we were mentioning, the nature of the virus. Now, a mask protects the person who is wearing it and the person who is on the other side of you. And because the mask, when you have on the mask, you talk, you laugh, you whatever, and you have droplets. That's how the virus is spread on the inside of the mask. Now I am an infected person and I am wearing a mask and it is all soil. Now just imagine me giving that mask to you. If that really is the case that has happened out there, you can see the danger of transferring that infection that I have from me to you and whoever else. So if that really has happened at the mental health facility, that is urgent need for concern for us as a union to have the issue addressed and addressed. No.
And when was that reported?
I want to get the exact letter.
What I'm trying to get from you is
That's
how
last
long
year.
has that been here?
Remember they were having the issue in relation to masks because when COVID came on board, the union took it upon itself to have meetings with various departments in terms of what should be in place to protect the workers and, well, in case of mental health patients. So all this was brought in the discussion, hoping that things would have been put in place. So that would have been like March of last year when we had our meetings with the various departments. So it's after that we were getting all of the complaints that you were getting masks, but this is the situation that was happening in relation to the masks. It was either not enough or we got this report that you have to pass it on or something like that.
Given the reports, were you able to investigate? Because you said you keep repeating that is what was reported.
Right.
But was it ever investigated to verify the accuracy of the truth in it? And if so, what has been done since?
We have had the opportunity to be on the ground, but not having access to the facility in the way that we wanted to have access. Because we would have reached out to management in terms of, for us as a union, paying a visit to the institution to see what was happening. We were actually denied, Brother Boucher, entrance to a certain level and not on the inside to see what is actually happening. If they were masked, not masked, whatever. So we in terms of our investigations were limited in terms of us having being there in person to see what is happening. But we would have had reliable sources to say this is what is happening at the mental health facility. But for us as a union, getting there, we were only allowed limited entrance so that we can actually be on the spot to see what the workers was reported is what was in fact happening at the institution.
And currently, what is the population like at mental health center?
The last count is 270, generally. 213. Okay, so it's somewhere between 213 and 220, somewhere there.
So you're saying that as it is now, you
That's
have
generally
almost
for
50,
patients.
right?
And then we have 100 and something infected cases.
Right, so you're saying effectively that you have around just about 50%
Yes,
infected. And what is the staff like?
The staff, we had what, 45?
No, I don't know.
We didn't have the count for the staff.
Approximately.
Around 60.
Staff
60
members.
staff members, and how many the last count were affected?
9.
No, you have more than 9.
And
11 staff. Two persons were tested positive.
Today?
Yeah,
So 11.
staff, one yesterday.
So
11
the
staff.
count in terms of staff being affected is 11.
11.
The last count.
and how many at any one time? How many staff members are on duty? Because I understand they might be 2 or 3 shifts. So
They have 3 shifts.
Then under normal circumstances.
Yes, under normal circumstances, you have 3 shifts. So you have a shift from 7 in the morning to 1, a shift from 1 to 7, and then you have a night shift that would run from 7 p.m. to 7 a.m. in the morning. So on the average time, you may have 2 staff nurses, with a nursing assistant or 2, depending on how they're working, and like 3 or so, what's the name, nursing aides, and the meal attendant. And that is, you have the female side, you have the male side. The female is a less in terms of the population, but the male side is what has the mass majority of patients.
Adding to that, you mentioned that there's now a new location where those infected,
Yes.
they're housing.
Yes.
All 100 and something.
All 100 and something from last count that we were told is housed in that facility, where everybody is in the same space. And you heard our industrial relation officer mention in terms of 2 persons sharing a bed, persons on the floor, and so forth.
Now, what does that say for, yes, all of them are COVID positive, but what does that say for recovery and
longer recovery time? Longer recovery time, because it means that everybody, because they're in the same space, they probably would not have had all of the protective, or probably not wear them, because we know we're dealing with persons who of a certain capacity in terms of their mental health. So you have all that happening, and you have how the virus is spread, and we're in one enclosed area, sharing the same space. There's no distance, so you see that they're going to be, the chances of them getting reinfected, and the recovery time is just going to be longer than expected, and persons at that stage will be exposed to further complication because they're going to be infected at a longer time.
What about the personal safety, security of workers at that new location?
We didn't get any reports in terms of who is actually doing the security there. So that we will have to find out. They didn't make any complaint in relation to them not being secured, and we didn't secure that information either to say if there's a farm, if there's a company that is doing the security there, or they are doing their own security. So that information we will have to get and further investigate.
You said that there's a problem with getting adequate supply of PPE or the mask.
Yes.
Why is that so? Is there a shortage?
We have been trying to ascertain that ourselves, because ever so often we have the Ministry of Health officials would let us know that we don't have a shortage. We would have imported how many thousands of masks, thousands of PPE, etc., etc. And they've been sent out to the various areas. So why is it that it's not trickling down to the persons who are on the floor? As Mr. Boucher would have mentioned in terms of the management, the link between where the supplies come in and where it gets to the persons seems to be the problem. That they mentioned it when they would have ordered from, because one of the correspondents mentioned it, when they order from the health, the store area, the medical store area, they've been told that they're not supposed to have this or they're not supposed to have that. So somebody has to give that directive. It has to come from management. And for me to order, it's not like they're saying to me, you're ordering but these supplies are not available. You're saying to me, we can't give such and such to you because this is the order we have.
Is there some sort of discrimination in terms of where they're distributed these masks and PPE?
In terms of the mental facility? or as opposed to any of the other facility?
Well,
Other-
because of it is a mental facility, mental health facility, particularly.
Children, if I may,
I-
I don't think the problem is not the distribution of masks. The problem is the management. I work at the hospital. There has never been a problem getting masks when the need arises. In fact, every time I enter the compound for the day, at least you have at least 2 masks available to you, because you can't be in 1 mask for a whole day, right? The hospital administrator made it possible for every staff member to have access to the necessary equipment they need to be granted protection on the job. In other departments, it is the same. This problem within the health sector lies with the management. It's not that the ministry, it's not an issue, and I don't think it's an issue of the ministry not issuing. It is the management. We have been to meeting with the permanent secretary who have said in our presence, give the workers what they need to protect themselves and get the job done. When you go back out and they go back to their workplaces, you might start off good for a week, a month, and then they go back to the same thing. The problem is Sister Giljas and Miss Medford. It's a basic thing of management. If you have different management, you will not have this problem. Because I know that the ministry, through the permanent secretary, would have made the intervention, would have said in a meeting, no, this can't be happening. I already say in meeting, Grace Walters was there and said, no, they must be given the necessary equipment. So the top management in health is of that position. The problem lies with who manages the institution. And I've heard in maybe this is not fair, but I've heard perhaps because, I don't know, Medford probably have political clout or connections. She does that she like. I've heard that too.
She's unconscious.
So nobody, well, I didn't say that she with that. So there is perhaps not the willingness to address it because of whatever reasons. But it has affected and impacted the organization severely now that you have seen what is happening here. It's really unforgivable what is occurring here. They must take some sort of the full responsibility. They must. If they were making an effort, and because the place is overcrowded, and they would have missed one quarantine person or whatever. I mean, but they were just negligent. And we know that because we were trying to address this thing since last year when our COVID break.
So you have workers that the union represent, yet you're not able to fully investigate their concerns. You're being prevented at a certain level. You have violations, human rights violations, as you pointed out. What is how far is the union prepared to go with this? And what can you do? Because you're being pressing demand. What can you do to bring about some solution as a union?
That's what I'll say this. It's not just that we are barred from even going and inspect the country under which workers operate. I went there sometime last year, wanted to see. I think at that time they had the outpouring of stool and all. Everything was just chaotic, and the nurses were exposed to that. Everything was spraying out. A call was made to Medford by the staff, the sister that was there at the time, and the response was, ensure that the security does not allow Mr. Boucher to go past that gate. So, I mean, I said, so what? You guys gonna lock me up or something? But the good thing is I had already gone in and come back out because I know what the attitude is. So I went in, examined what I had to examine, and came back and I was talking to her. When I said, out of curiosity, I need to go in and examine what's happening. And was prevented from even doing that. A union prevented from looking at the conditions under which workers are operating and which patients themselves have to exist. We were going to take industrial action last year, and when we were about to do that, there was a flurry of activities. And we got the impression, well, okay, they get the message, and things would have been different. But things just went back to normal until the workers say the union really wasn't doing enough. See, this outbreak have really exposed all of the weaknesses. That is what it has done. So we will just wait and see how this thing is being handled. We'll wait and see, following this, what the ministry or the government is willing to do with respect to mental health institution before deciding with the workers what step to take. There's an opportunity, like I said, for reform. I know that the ministry has plans or given plans by former SNO of the institution that speaks to how best to reform the organization or the institution. Maybe those plans are just lying catching dust on a shelf. They need to take them out and take mental health seriously. Take it seriously and try and find some way of alleviating some of the problems here, including, of course, the overcrowding.
Thank you.
You have a question?
It was mentioned that quarantining of the incoming patients was one of the requirements
Right.
for them to enter the institution.
Yes.
Who was responsible for implementing that quarantine period, and what did the screening process overall entail for incoming patients?
The 14-day quarantine was from the Ministry of Health as a requirement to avoid other patients from catching the virus, just in case someone who's the admitting person has it. So it was a directive came out of a meeting, a Ministry of Health meeting, and the management was supposed to put things in place to ensure that is upheld at the institution. The problem was spacing. One of the problems was space in terms of where you actually do the admission in an area where it was small, and then because of the quick turnover time in terms of admissions, there wasn't enough space. So we were told to pause persons for the entire 14-day period. We were made to understand that apart from the normal questioning and physical assessment of the patient that would have been in the admission process, that all the patients in recent times would have been subjected to COVID test, which is the antibody testing, the rapid antibody testing that our patients coming in would have had. Some of those patients who were told who were negative on that test ended up to be positive on the PCR test.
So would you say that the screening process was followed strictly?
In terms of the testing?
Overall.
To some extent it was, because they were screened for the virus. But if they had the screening process in collaboration with the 14-day period, because we're looking at the incubation period for the virus, you probably would have caught that between that period before the person was thrown into the general population. To some extent it was, but it just needed the follow-up to work along with the quarantine 14 days. Are there any other questions?
How much people the mental institution
Can accommodate? Comfortably, 90.
90?
Comfortably with appropriate spacing and all of that story. So they're way past their capacity. Yes.
There been a recent development in numbers that's gonna be
At the actual facility, it has always been a lot. Two something, one something, depending on more men than women. But the facility has been overcrowded for a while now.
Can we say how many males and females are affected?
How many males and females? No, we don't have that information. As in official. I know they're the majority of males, but in terms of an official exact figure, we don't have that. Any other questions? No?
Okay. If there are no other questions, just to let you know that regarding the deferral of the customer service charge, we have written to the Minister of Finance. That letter has gone to him and copied to the Prime Minister. So we have actually put that in writing and made the request, suggestion to the government for the deferral.
Okay,
Alright.
so if there's no further questions, we want to thank you for coming, members of the media, and we're hoping that the information would get out and we would get some of the issues addressed urgently where the members, workers at mental health are concerned. So thank you again for coming. Have a good day and continue to be safe.